small complex, and I'm in the presence of two very powerful men right now. On my right is the Minister of Health, and on my left is the Prime Minister. We're in the dialysis room, and they're going to give me their equal perspective on the modern medical, what we've achieved so far, and what does that mean for Vincentians. So I'll start with the man on the left.
Well, all power to Luke. You said two powerful men, but I want to give all power to Luke because he's the minister who is completing this project, and he's doing very well.
You're the Prime Minister.
Well, as Brother Laborde, who is doing the finishing here, the technical heavy, he tells us that we have 280,000 square feet of floor space. We are having some very important addition to the delivery of health care services. First of all, right here where we are, this would be the first state-operated dialysis facility for persons who have acute kidney problems. So this itself, right where we are, is a very significant innovation.
This history in the making.
Yes, this one. And then we have an area, a significant area for accident and emergency. When that is operationalized, we are going to take about 35% of the pressure on Milton Cato Memorial Accident and Emergency, because this area will serve basically from Bayabu to Fancy, which is about 40,000 people. So that the waiting time down at Milton Cato Memorial, which a lot of people complain about, though throughout the world you have long periods of waiting at accident and emergency because it's what it says, accident and emergency, and a lot of people go out there who are neither involved in accidents or in emergencies, but that is how life is. So that is a very important area. We're going to have out here for the first time a small operating theater. We're going to have specialist diagnostic work and treatment work for ophthalmology. We have an excellent lab, the facilities here, both in itself for the 40,000 persons, but to do work which Milton Cato Memorial would also send for us. So it would help Milton Cato in that regard too. We have an intensive care unit here with the facilities for 4 beds. Milton Cato has 2. For a 200-room hospital, they really need 4. So that you can see that when some persons were down there, go past the critical period in ICU, rather than send them on the wards, even though you may feel that perhaps should keep them a little longer, the demand is such there. So you may send here. Or you may, in fact, bring them here in the first place. Then there's an area which was not originally set out for oncology to deal with cancer patients. There's a lot of space, and the Chief Medical Officer and Donna Bascom from the hospital administration, they are of the view, and with the PSA too, Permanent Secretary, that the space could perhaps better be utilized by putting the oncology unit there, so you have the chemotherapy facilities, lots of space there. Just to be an area to deal with certain acute patients, but acute ailments, but they have enough room to cover those areas.
So all the critical areas of health.
All the critical areas will be covered here, plus some. What we have in at Milton Cato, the plus will be, for instance, the dialysis facility. Now, it is important to grasp this. The problem of persons with cancer is a real expensive thing. So to dialysis, and people have to go overseas for chemotherapy. Though we have chemo down at the hospital, but also for radiation, and we'll have to up it here also for radiation. The cheapest place is Guyana, but you'll have to go for 6 weeks, 8 weeks sometimes. Trinidad and Barbados, expensive. Though Cuba is not as expensive, it's still a challenge. Guyana is the cheapest. So we can have here that particular addition. So you can do from accident and emergency, all the lab work. You have the pharmacological work. You have ophthalmology, seeing about your eyes. You have surgery. You have the medical, internal medicine, analyses, diagnostic work. And this here will be linked to the Georgetown Smart Hospital, which has about 20 beds or thereabouts, which will provide the support with beds for here. Even though you'll have beds here too, but it's here, there's so much diagnostic work which is going to be done that you link it well with that one, so that you may end up having something like 20 little bit beds here, and you have 20 there. There's a huge number for a facility or facilities of this kind, and this is, frankly speaking, a revolutionary step forward in the delivery of healthcare. It's a huge addition to the health infrastructure. Of course, we have to thank the government and people of Cuba, first of all Fidel, and when it opens I will tell stories as to how they started and they relay with it with Raul. The Cuban foreign minister came here and with me broke the ground several years ago. And then of course we got monies from, we borrowed monies from the NIS. We used some of the central government funds too. And over the period of time, we simply made sure that we have it accomplished of a very high quality. Of course, the critics may say that it could have finished earlier. But, you know, we have a whole saying up here, and Lucas talking about it, or about Nabil goodness. And this is a goodness. This is a goodness, and there was some challenges beyond our control in relation to some of the time.
So we're expecting a grand opening?
Well, hopefully, Luke and I were talking about it. We'll have to talk to our cabinet colleagues, maybe sometime in March, because the wonderful little things to be done. Brother Laborde showed me he has to put in some, he had to put in some things for the laundry. He has to, the pump, he has to put in some stuff, some furniture has to come in, some other pieces of equipment, and then the place has to be cleaned. I see the painters are around doing some finishing touches and so forth, and the road, Braxa is fixing the road.
And the parking lot.
And the parking lot, and the outdoor facilities. And I'm hoping when we have in the management here, because a deputy hospital administrator is going to be here to control the whole complex, including the Georgetown Smart Hospital and this, that we make sure that these beautiful spaces where we have plants and flowers, the facility doesn't look drab.
We'll pay attention to the environmental aspect of
We have to
things.
pay attention to all of those things. So it's in short, simply a magnificent facility.
And you're pleased with what you've seen so far?
Very pleased. And I must say, since Brother Laborde has come on, he has done a lot of work, even though as he says that he has been here before. And we have to thank Mrs. Myers, and we have to thank Ray Duggan, who are here all year doing work, and all the people who contributed, mainly workers from around this area, in North Central Windward and North Windward, who built this along with our Cuban comrades. So it is yet another manifestation of our friendship, Cubans, St. Vincent and the Grenadines. And of course, we're going to have in the budget this year, we are having 40-something staff members plus 22, 23 Cubans who are coming in additional under the program which we have.
So health is being placed as a priority?
A serious priority. This is a major infrastructural addition, no question about it. What we have to do also, I was speaking to the Chief Medical Officer, Simone Kiza Beach, that we'll have to get additional ambulance services too, and of an appropriate kind. I hope Stuart Haynes is hearing me and the NIS because I'm coming to the NIS for them to buy one. A good and enlarged one where, you know, we got some from Taiwan and we are pleased with them, but as always, we have to up the game.
All right. Thank you, PM. We're happy for the emphasis and the importance that is being placed on health of our nation, because a healthy people is a wealthy people, and our minister has been working hard in that regard.
Very much.
Congratulations, Minister, so far on the work that we've been able.
For the last few weeks, he's been coming up here almost every day. He's almost like a contractor now. Because the cabinet was on his back, and I will tell you, I'm going to Haiti for the CARICOM meeting, intercessional, on the 25th. I'll be away there for 3 days maybe, and I told him normally I was going to take him, but I told him no, he can't come. He has to stay here so that we can open this in next month in March.
All right.
Sometime in March.
Minister, your time to respond.
Well, PM, just to say thank you for the confidence, first of all, that you've put in me and placed in me in relation to the appointment to such an important portfolio, especially at this critical juncture of the life of health in St. Vincent and the Grenadines. And as a result of that, I've had the responsibility for more or less seeing through an important vision as far as where we could take St. Vincent and the Grenadines. And this modern medical complex is a very important component of that vision. What we have here, as the PM has outlined very clearly what we have here in this facility in terms of the vastness of its scope, in terms of the services that will be provided here, in terms of the staff that will be on hand to take care of that service, those services. And it's something magnificent waiting to happen, especially when we understand that it would help us to really go further along the road towards achieving that ideal of universal health coverage.
Well, so you will also looking at medical tourism, because in terms of what you're looking to put in, it would be attracting persons to come here to receive healthcare services as well.
Well, surely we look into medical tourism, but one of the things that we got to flag, because as the Prime Minister pointed out, is something that never happened before in our history, is that through this facility we'd be able to provide dialysis services in a public space for the first time in St. Vincent. That is a big development. We understand the significant cost that dialysis represents for persons, and we know that most individuals who have faced the problem of kidney failure in the past essentially were grappling with something that was almost like a death sentence. So we have changed the situation for them in a fundamental way, and that is something that should be celebrated. And the Prime Minister, not content to leave it there, has obviously signaled an intention to make some major strides in terms of oncology. Because when you look at those two issues, when you look at our statistics, you see, and we signed an agreement recently for a capacity building project in relation to preventing and control diabetes. You realize that diabetes and non-communicable diseases, lead to various kinds of problems that we'd have to contend with here. Diabetes, which is a big problem in this country, has led to persons having kidney failure and needing dialysis. So this is a part of our capacity building in a sense. So we're very happy. We are now looking to make arrangements for the finalization of this building. Many persons in the past few weeks have played a role. The Prime Minister has mentioned some. He has mentioned the work which is being done by Elliot Laborde here, who occupies the substantive post of site architect, but who has essentially been managing the project recently. And we have other stakeholders who have come on board. We have Vinlec, for instance, that helped us with the installation of a generator recently. It's when we were in these final phases of development. We have CWSA that has been helpful in a number of respects, and different state agencies have basically chipped in. Even National Properties assisted when the Permanent Secretary made a request of them for some assistance. And we have BRAGSA, very importantly now, assisting with access roads and assisting with the car park, and they have been working diligently and dutifully with respect to that. We are now in the process of making sure that, well, we see that the dialysis unit here has already been set up.
The entire wing actually is set up.
We had a test case, the entire wing is set up. We had the folks coming from Renal Dynamics to do it. So this is now basically ready to go.
Staff being trained.
Precisely, and actually right now there are several components of the service several services that we could begin to offer at this facility. We are really at a very good place, an exciting place, and a place that represents, as I said in Parliament, a great jump, for health, and that's going to equip us to better deal with this fight against disease and sickness in our country. And that is something that is almost a sacred part of what any civilization should be taken care of. But right now too, we have BRAGSA, they're doing the road work. I think that they will be able to settle that shortly. And you see there's the possibility for great integration of facilities, integration of this facility with the smart hospital and even the clinic. One way in which we could make the integration more complete is perhaps by having a uniform color code in the painting of the building. But more than that, you see, I mean, this is a hospital that is excellent in its own right, and that could attract a lot of interest. I mean, you raised the point of the medical tourists, but even beyond the medical tourists, there's a concrete possibility in relation to medical schools too.
Absolutely.
Offshore medical schools that are here that could be able to basically.
One of them had indicated that they wanted to come.
Mm-hmm.
Okay. So one medical school has already indicated that they wanted to be here. That is serious. That is not only medical benefits. That is economic benefits as well tied up there. So this facility is strategic from the standpoint of achieving health and even economic objectives.
If you take into account the 20-odd Cubans who are coming here, they're going to have to live in this area. It means rents. There are a lot of people who are going to be coming here for one service or the other. It means that the restaurants around the area are going to make money. This here is an industry, is a small industry which you're going to have. I mean, Milton Keto Memorial is a big industry of over a staff of 600. But this one is going to be intimately connected with this community. I want to say this additionally. We have built in recent years 3 polyclinics 24 hours. We have equipped one and it's operational, the one at Stubbs. We'll be doing so shortly in Mespo and down at Bukamen. This is in addition to the 39 clinics which we have had before, and during our time we have done several of them. we have just rebuilt really the mental health rehabilitation center, a new facility.
$4.1 million.
Absolutely.
What's
Then
the figure?
$4.1 million is the cost of the work that was done on the mental health center.
then we have what was done at Milton Cato Memorial, nearly $6 million. We fixed up the ICU area, the kitchen. We did the female wards. We have done work down at pediatrics. We did operating theater. We put an additional operating theater. Then the entire wing down there for pediatrics, persons between birth and 21 years. In conjunction with the World Pediatric Project, we had some assistance too from the Musty Company through the Musty Charitable Trust. And the OECS has declared Milton Cato Memorial to be the Center of Excellence for Pediatric Care in the Eastern Caribbean. People from all about come here. They have provided already WPP for our country and the region immediately over $100 million in service since 2002. I'm not talking about our component, I'm talking just theirs alone. And critical health care for persons between birth and 21. Critical. So all of these things are what we have seen in the addition to the health infrastructure. And we have just last month finalized the consultancy for the designs for the acute hospital, the acute referral hospital, the 130 bed out at Annisvale. It will take about 18 months or so to do the designs and to give us a plan for every single room, what equipment we're going to put in it. The World Bank is financing that part. All I need to know is to have a target number, which I have to work with for the construction and equipping, so that I could start on the road and looking for the money. And so that these are major additions. Quietly, okay, I know the complaints about this or that. And I hear that. And the one you get most is about medication, pharmaceutical products, tablets, medicine. This year, we have $8.3 million in our budget for materials and supplies. That is under the central medical stores, which deal with the pharmaceuticals. And a person may say, okay, you have that, but do you spend that? In 2016, we spent $8.1 million. And 90% of what the prescriptions the doctors write are filled. But if somebody doesn't get one set of tablets down there, they make a big noise. Whereas, and when they fill a tablet, when they fill their prescription, as in 90% are filled, it's $5 they pay now. $5, even though it's $100, $120, $150 worth of medicine. And if you ask them to pay another $5 for something else, though they're not, you hear the noise, how the hospital is wicked, but every single morning they will buy juicy for the children. So that's an issue with all of these things which we have to talk about soberly. In 2001, there were 51 medical practitioners at Milton Cato Memorial. Today, we have 90. You had 15 consultants, 14 or 15 in 2001. Now you have 20. The specialities have broadened, widened, deepened. And there are good news to talk about health. But you have a few blowhards who just pick out the one or two problems which you have.
And more opportunities are opening up for specialist areas in health.
And then the training of nurses and doctors, and so on and so forth.
Now, one of the things that could perhaps be mentioned too as well, PM, is that PAHO has an idea that this facility could also be a place for preventative, a preventative approach to health, and for it to be more or less an area where we try to tackle non-communicable diseases with some preventative measures. So we're hoping that that takes off too, and it will take off because this year, as we could see from what we've said already in this interview, is going to be a big year for health. We have this facility, we're hoping to open polyclinics soon. There's work being done on smart hospitals. There's what smart hospital was done here in Chateaubelair. We're hoping to have another smart hospital in the Grenadines. We're looking to do a smart hospital which in Union Island, and also for the Mayo Clinic to benefit from that project as well. So there are those things happening, and we have very important, it's not just a matter of investing in infrastructure. Human resources is important, and the Prime Minister already indicated.
And remember, we did the hospital, fix it up in Port Elizabeth, and we rebuilt it.
Oh yes, we just.
There's so many things sometimes you forget.
Well, how are we going to manage the staffing, Minister?
Well, staffing is something that we have. I mean, first of all, in terms of nursing staff, we have a pool of trained nurses that we could draw upon, consequent upon the government policy of more or less financing education by providing stipends for those who would otherwise not be able to afford training. And we're investing in other areas of training under several projects, including the modernization of the health sector. The point I want to make too, because it's important, is an important matter that is an outgrowth of the public policy of the government in health, that we've just launched a Health and Wellness Commission under the leadership of Dr. Timothy Providence, and that commission is going to be tasked with looking at some of the preventative aspects of things as well. So that commission and its work is going to be integrated with what we're doing at this facility. So we don't want you to just come here at the end stage. You could come here at different stages of your problem and receive appropriate guidance relevant to your particular stage. That's something that is important. Of course, the Wellness Commission would deal with there'll be other things that are part of its mandate, including what we do through the schools and what we do in some other areas to make sure that physical activity is integrated properly in schedules, to ensure that we teach appropriate eating habits and other behavioral practices consistent with what we want to see for the health